Welcome to the Centers for Medicare and Medicaid Services module, the Hospice Item Set, HIS, General Information. This module will introduce learners to broader details of HIS data collection guidelines as well as the HIS-based quality measures. This is the first of 8 modules in the larger series of modules focused on HIS coding guidance. The series overall is intended for users who are familiar with HIS coding and submission guidelines. For newer users, we recommend starting with the HIS manual and older trainings first. These modules will not cover all items in all sections. Learners may choose to listen to the entire series or may choose to listen to 1 or 2 modules that are of most interest to them, meaning the modules in this series can be watched independently or as a group. Included here on Slide 2 is a list of acronyms that will be used in this presentation listed in alphabetical order. After completing this module, learners will be able to listen to the Hospice Item Set HIS measures, identify who can complete and submit the HIS record, define completion and submission deadlines, describe the difference between HIS completion deadline and quality measure credit, and identify resources for quality measure calculations. Remember, the Hospice Quality Reporting Program, or HQRP, equals HIS plus hospice CAPS. Although the HQRP comprises both requirements, this series of modules focuses only on HIS requirements. Let's start with sections that are covered in HIS data collection. You will notice that the data collected varies depending on which HIS record is being completed. The HIS admission record collects data from sections A, F, J, N, and Z, while the HIS discharge record collects data from sections A, O, and Z. Some of the items that are collected in the admission from section A are not collected again in the HIS discharge. The items in section O are only collected for discharges that end in death, and the items in section F, J, and N are only collected for the HIS admission. As you may recall, all Medicare-certified hospice providers are required to collect and submit HIS data to CMS as part of HQRP requirements. CMS then uses the submitted data to calculate hospice facility-level performance on quality measures. Some of the quality measure data is then publicly reported on Hospice Compare. Specifically, HIS data is used to calculate 9 different quality measures. 8 of the 9 measures are National Quality Forum, or NQF, endorsed. NQF-endorsed measures are considered the gold standard for healthcare measurement in the United States. The most recently NQF-endorsed measure is the composite measure. The 9th measure is the hospice visits when death is imminent measure pair. All Medicare-certified hospices are required to submit HIS data. An HIS admission and HIS discharge record is required for all patients regardless of payer, age, where patient receives their hospice services, and length of stay. The HIS can be completed by any hospice staff member. When completing the HIS items, it should be based on what has been documented in the patient's clinical record. For instance, if a patient tells the nurse that he or she is having severe pain, it must be documented in the patient's record for it to be coded as such in the HIS record. This is particularly important when the HIS is being abstracted by a hospice staff member who did not have the discussion with the patient. Now that we have a general understanding of what the HIS is and who can complete it, let's talk about timeline for completing and submitting an HIS record. The completion deadline is the latest possible date on which a provider is encouraged to complete an HIS record. Completion deadlines are recommended and not considered in the annual payment update, otherwise known as the APU. The recommended completion for an HIS admission is the admission date plus 14 calendar days, and the recommended completion for HIS discharge is the discharge date plus 7 days. CMS continues to recommend that providers complete and attempt to submit HIS records early, prior to the submission deadline of 30 days, to allow ample time to address any technical issues encountered in the KEYS ASAP submission process, such as correcting fatal error messages. The submission deadline is defined as the latest possible date on which the HIS record should be submitted and accepted by the KEYS ASAP system. Unlike the recommended completion deadline, the submission deadline does affect compliance with the HIS requirements and the APU. Providers must submit a minimum percentage of their records on time to be compliant. Submission deadlines for all HIS records is the target date, which is the patient's admission or discharge date, plus 30 calendar days. Meaning, the submission deadline for the HIS admission record is the admission date plus 30 calendar days, and the submission deadline for the HIS discharge record is no later than the discharge date plus 30 days. To ensure records are submitted and accepted, providers should review their final validation report in CASPR. Earlier, I mentioned that you have a recommended 14 days to complete HIS records. However, I want to talk now about the difference between the recommended completion timing and what earns credit for the quality measures. Some HIS data allows for collection during the entire time frame under consideration, which is up to 14 days, but the care process may need to have been completed sooner for quality measure inclusion. Let's look at some examples. The distinction between completing HIS items and quality measure credit is a question that often comes up on our help desk. We've listed some examples here on slide 10. First, let's look at an example for pain. J0900 asks if the patient was screened for pain. Pain screening can be abstracted any time between the admission and 14 days. The date of the first pain screening is reported. However, to meet the quality measure or get credit, the patient's first pain screen must occur within 2 days of admission to hospice. In another example, J2030 asks if the patient was screened for shortness of breath. Screening for dyspnea can be abstracted any time between the admission and 14 days. Like J0900, the date of the first dyspnea screening is reported, and to meet the quality measure or get credit, the patient's first pain screen must occur within 2 days of admission. Treatment preferences can be abstracted any time between the admission and 14 days, but to get credit for the quality measure, the patient or caregiver should be asked about treatment preferences no more than 7 days prior to the admission or within 5 days of the admission date. This is also true for F3000, spiritual existential concerns, in which the patient or caregiver should be asked about spiritual existential concerns no more than 7 days prior to admission or within 5 days of the admission date. As you can see from the examples here on slide 10, although the recommended completion timing is the same across all HIS admission records, the timing for quality measure credit varies from measure to measure. This is important to keep in mind for your hospice's performance, as well as for the delivery of high-quality care for your patients. The remaining modules in this series will discuss the quality measure specifications in more detail. We just wanted to introduce the notion of HIS completion versus quality measure credit here. If you're interested in learning more about the quality measure specifications, we recommend watching the remaining modules in this series. While the series overall is intended for users who are familiar with HIS coding and submission guidelines, information regarding the Hospice Quality Reporting Program can be found by clicking the hyperlink on this resource slide. This resource slide also contains hyperlinks to specifics on the HIS Hospice Quality Measures, the QM User's Manual, and the HIS Manual V2 with the change table. The Hospice Quality Help Desk is available to assist with general questions about the Hospice Quality Reporting Program. This concludes the module Hospice Item Set General Information. This is the first of 8 modules in the series Hospice Item Set Coding. This module introduced learners to the HIS, including information and HIS completion and submission timing, as well as distinguishing between completion deadlines and receiving credit for the quality measures. The other modules in this training series are listed here. We encourage you to view these training modules as well to understand more about HIS coding and learn how it may help you in your hospice. Thank you for viewing this presentation. The information presented was correct as of the date it was recorded. This presentation is not a legal document. Official Medicare program legal guidance is contained in the relevant statutes, regulations, and rulings.